A very good day. We are from Group F, would like to present about the counseling on GTN. There are two types of sublingual GTN, tablets and spray. GTN, a glyceryl trinitrate, is a nitrate. It is indicated to increase the blood supply to the heart muscle and relieve or prevent the chest pain by improve the myocardial oxygen supply. It works by reducing the preload and afterload, thereby relieve the pressure and decrease the heart workload. The usual dose of GTN is 300 to 600 micrograms. It is administered as one tablet placed under the tongue. This can repeated every 5 minutes up to 3 doses. GTN is typically used before exercise and during the sudden angina attack to alleviate the symptoms. If angina symptoms are not relieved by first dose, the second dose should be taken while on the way to the hospital to seek the medical support. GTN must be used sublingually to allow the quick onset of action because it dissolves and it absorbs directly into the bloodstream through the rich network of blood vessels in the sublingual mucosa. This method can avoid the first pass metabolism. If shallow, the drug must pass through the GI tract or gastrointestinal tract and be absorbed through the stomach and intestine, which can reduce the drug's bioavailability, delays its action, and decrease its therapeutic effect. Additionally, shallow of the sublingual GTN can lead to uncontrolled absorption, prolong its action in the body, and potentially causing hypotension and headache due to the vasodilation. Now, let's look on how to counseling the sublingual GTN tablet.
Good afternoon, I am Aziana. I am a pharmacist here. How are you feeling today?
Good afternoon, I'm fine. Thank you.
That's great. You are the neurologist, right?
Yes, I am.
Well, as you may know, you have just been prescribed sublingual glyceryl nitrate for your angina. Has your doctor informed you what this medication is for?
I only know that I need to take it to relieve chest pain.
Okay, that's fine. I will explain more to you so that you can use it correctly and effectively. So basically, GTN is a medication that can widen the arteries that carry blood to the heart muscle. You are given this medication to treat your angina.
Oh, I see.
So you need to take one tablet, which is 300 micrograms when you experience chest pain. Place it under the tongue and let it dissolve completely. After the pain has been relieved, you may spit out what is left to avoid its side effects. If the chest pain persists even after 5 minutes, place a new one under the tongue. You may repeat this up to 3 times only. If the pain persists or becomes more intense, seek emergency medical attention immediately.
Okay, that's clear.
Make sure you are seated or lying down before taking the medication because it may cause dizziness or fainting. Don't chew, crush or swallow the tablet or they may not work as well.
Oh, okay. Are there any side effects that I should be aware of?
Yes, common side effects include headache, dizziness and flushing. These are usually temporary. Make sure to sit or lie down after taking the medication to minimize dizziness. If you experience any severe side effects like fainting or an unusually fast or slow heartbeat, seek medical help right away. Inform your doctor if you are taking any other medications, including over-the-counter drugs and supplements. Also, if you are taking any other medications for hypertension, do inform your doctor as it can enhance the blood pressure lowering effects. If you are planning for pregnancy, consult your doctor first before taking this medicine.
I'll keep that in mind. How should I store these tablets?
Keep them in their original container, tightly close and store them at room temperature away from moisture, heat and light. Don't transfer them to other containers. Do discard the tablets 2 months after the first opening of the bottle Make sure to make the date of the opening on the bottle. Hot and tingling sensation under your tongue while taking these medicines prove that it is still effective. Thus, the absence of these sensations may indicate that the medication is no longer effective.
Oh, I got it. Is there anything else I should know?
Just remember to carry your medications with you at all times in case of an angina attack. If you notice your angina symptoms becoming more frequent or severe, contact your doctor. And if you have any other questions or concerns, don't hesitate to ask.
Thank you so much for your time.
You're welcome. Take care and have a great day.
Next is sublingual GTN spray. So what is a sublingual GTN spray? So GTN spray, also known as glyceryl trinitrate spray, is a fast-acting nitrate medication where nitrates are a class of drugs that work by relaxing and widening blood vessels so blood can flow more easily to the heart. So the spray is typically packaged in a small portable aerosol canister, making it convenient for patients to carry and use when needed. So what is GTN spray used for? So GTN spray is indicated to treat angina pectoris, which is a chest pain caused by reduced blood flow to the heart. So how does the spray work? GTN sprays work by releasing nitric oxide, which relaxes the smooth muscles of blood vessels, particularly the coronary arteries, which are located in the heart. Then, this vasodilation resulted in increases blood flow to the heart muscle, reduces the heart's workload, and also decreases oxygen demand of the heart. So eventually, these combined effects will alleviate the chest pain associated with angina. So when the spray can be used? Patient can use GTN spray during an angina attack to provide immediate relief of the chest pain and also prevent angina attacks triggered by physical exertion, emotional stress, or exposure to cold. How to administer GTN spray? The GTN spray must be administered sublingually, which is spray under the tongue to absorb directly into the bloodstream and avoid the first pass metabolism, therefore giving the rapid relief of angina symptoms. Then, how about the frequency? So for relief of chest pain or acute angina, the GTN spray can be used every 5 minutes up to 3 times of spray. However, if the pain is still not relieved after 15 minutes of the first spray, patients are advised to seek medical attention immediately. As for prevention of angina attack, patient can spray 1 or 2 sprays under their tongue 2 to 3 minutes before the activity that likely to cause the angina. Now, let's look on how to counsel patient on their sublingual GTN spray medication.
Good morning, Mr. Danish. I am Haziq, your pharmacist in charge for today. How you been feeling lately?
Good morning, Mr. Haziq. I'm feeling better since last time, but I still get some chest tightness occasionally.
From what you described just now, you might be experiencing angina, which is a chest pain that caused from your blood flow reduced to the heart.
Angina? That sounds serious.
Yes, it is very serious. That is the reason of why you've been prescribed of GTN spray, which is used to relieve your angina symptoms. Have you used it yet?
I have not. I wanted to make sure that I understand everything before I start the medication.
I understand. Let's go over how to use the GTN spray and what can you expect. And by the way, there's a great approach. When you feel chest pain, you should sit down and spray the GTN spray under your tongue. And make sure to keep the GTN spray upright and avoid to swallowing immediately to let it absorb. Also, you can take up to 3 sprays in a 15-minute period with 5-minute intervals between each spray if the pain persists. Does that make sense for you?
Yes, it does. But how long does it take to work?
Basically, the spray typically starts to work within 1 to 2 minutes. You should feel the relief immediately. However, if the pain doesn't improve after 3 sprays, you should call an emergency as it is a sign of more serious issue.
I see. Is there any side effect that I should be aware of?
Yes, there's a lot. Common side effects include headaches, dizziness, and flushing. This usually happens because GTN spray causes your blood widen, which increases your blood flow. So you need to make sure to sit down while taking the GTN spray to avoid dizziness or fainting. If you're experiencing any serious side effects or allergic reactions, seek the medical attention immediately.
Okay, got it. Should I keep all the time the medication?
Yes, it is very important to keep the GTN spray all the times because angina will attack anytime. Also check the expiry date regularly and replace it as needed.
Okay. Thank you. This has been very helpful. I really hope that from your advice, I can manage the chest pain very effectively.
You're welcome, Mr. Danish. Remember, if you have any more questions or concerns, don't hesitate to reach out to your healthcare provider. Stay safe and take care.
I will. Thank you.